So if we talk about the Egyptian Minister of Health and Population and the Minister, Professor Dr. Khaled Al-Affar, I believe that the ministry is undertaking several measures in line with their commitment to an integrated approach, as you mentioned, to nutrition and climate change. The developed policies, our health policies, they measure specifically targeted the mitigation and the impact of the climate change. We launched last year the National Nutrition and Food Strategy promoting healthy and sustainable food system. You mentioned as well ICAN, which is the Initiative for Climate Action and Nutrition, and both initiatives, as long as the FAST initiative as well, which is the Food and Agriculture Initiative for Sustainable Transformation, the main aim for that is to make sure that we are heading towards a climate change strategy of 2050. There is a focus on developing greenhouse and green health standards for hospitals accreditation, for example, comprehensive health adaptation plans to prepare our healthcare system either actually nationally or globally for climate-related challenges.
From your point of view, Dr. Anan, what are some of the procedures and measures taken by the Ministry of Health in this respect so far?
So far, we are talking about a lot of initiatives. We are talking about the ICAN, the Initiative for Climate Action and Nutrition. We are talking about the Food and Agriculture Initiative for Sustainable Transformation, what we call FAST, F-A-S-T. And they focus on accelerating efforts to tackle the impact of climate change. Mainly, we are discussing nutrition. The transitioning to sustainable food system is very important nowadays, and we are witnessing a lot of disconnection in the supply chain of food worldwide. On the other hand, FAST aims to help countries access necessary financing, and we are currently in a huge economic recession worldwide. So the necessary financing is very important to address the climate change and promote sustainable agriculture and food systems. Those initiatives, they actually synergize efforts to build, and this is very important, resilience in food security and nutrition against the climate change impacts.
Indeed. Also, Dr. Anan, the Minister of Health, pointed out the connection and the integration between the Initiative for the Climate Action, ICAN, and the Food and Agriculture Initiative for Sustainable Transformation, which Egypt has launched at the COP27. What are the features and the effects of these interactions?
So we were discussing just now the detail. If we can as well discuss what we are facing and what are the risks we are facing because of the climate change, and hence we are actually currently launching the initiatives. For example, the Earth's temperature has increased by only 1 degree since the beginning of the year 2000. And we can think that 1 degree of the Earth's temperature is not significant, but actually it's very significant. We do have as well the level of water bodies has increased by 2 millimeters. The global ice mass decreased by 3%. If we look at these figures and we think that it is actually diminished, the impact was actually huge. We had, because of that, an increase in 9 infectious diseases. We do have an increase in the chance of malaria by 66%. We do have by 2050 maybe 14% higher in numbers of malaria cases. We do have the West Nile fever, the Zika fever, Zika virus, the yellow fever, dengue fever in new regions currently, not like before. We are seeing that in Canada, which is a new territory for these viruses currently because of climate change. We do as well have a very significant chance of plague in Asia by 50% because of climate change. And if we are actually witnessing another 1%, only 1% increase in the Earth's temperature, maybe all the coral reefs in the Earth will actually be gone and bleached because of that. So very important, the initiatives you mentioned, to preserve climate change, to preserve resilience and sustainability of food and agriculture.
Yes, indeed, sir. Also, the effects of climate change, most notably the slow growth of agricultural crops productivity and the distributions in the weather events exposes millions actually of people to the risk of lack of security and food diversity. How that could be overcome, Dr. Anan?
So if we would like to face the risk of decreased agricultural productivity, as you mentioned, and the weather disturbances we are witnessing due to climate change, it's very crucial to adopt multifaceted approach. For example, we are talking about investing in sustainable agricultural practices. We need that to be actually cascaded. We do have good strategies, but poor implementation worldwide. Diversifying crops to reduce dependency on the new staple crops. We need as well to improve early warning systems for weather disturbances, and very, very crucial nowadays. Enhancing food storage. We need new technologies for food storage and distribution networks to prevent food loss and waste, especially waste. We are wasting a lot of food every year, and develop policies to ensure fair and equitable access to food resources. I believe this is the vision, and the most important thing is equity in food distribution.
Indeed. Sir, actually the climate change represents a threat to the progress of the health systems. Thus, it is hindering the efforts towards achieving the Sustainable Development Goals. How will Egypt face these challenges from your point of view, Dr. Anan?
So from the commitment, the Egyptian Minister of Population and Health, Dr. Khaled Abdel and President Sisi, Egypt plans to confront the challenges by public health systems. And this is actually the vision of Egypt 2030, is a person centricity and public health, improving early warning systems, for example, developing robust mechanisms to respond to emergencies. So we do have early warning for pandemics, emergencies, and climate change alarms, including building adaptive capacity for local, national, and international levels. And this is very important from human capacity and from IT infrastructure as well. And most important is to enhance the healthcare system to recognize and adapt the changing pattern of diseases. Because as I was just mentioning, we will witness a new pattern of diseases. Nowadays in Egypt, we are seeing a high percentage and incidence of diseases and viruses and bacteria that was actually common only in the south or common in sub-Saharan Africa because of climate change, for example. And we need to promote as well the green health standards and green hospitals. And this is the initiative that the Ministry of Health is actually adopting currently, especially that we are approaching the new health insurance that will be actually nationwide by 2030. So if we just take 30 seconds on the green hospital, because it's very important, the green hospitals will actually be working on the energy efficiency. For example, the lighting system, LED lighting, for example, LED is making efficiency by 60% more in terms of energy saving, water conservation, waste reduction, sustainable building materials, indoor environmental quality. So we do have a lot of KPIs that green hospitals, if we are actually cascading the idea to all hospitals, will help the efficiency of energy saving and climate change by 2030 and achieving our goal.
Yes. Dr. Anan, actually, how do you see the President's participation in the COP28 summit taking place in Abu Dhabi, in Dubai?
So if we are talking about that, I believe it focuses on the importance of the topic. The President's participation in the COP28 reflects Egypt's serious commitment to addressing the climate change issues. It underscores the nation leadership role in global climate discourse, especially when the President's actually discussing it with the key players to make sure that we are integrating climate action with public health and nutrition. The President's involvement is very important. It brings high level of attention. It brings urgency to those issues, the climate change, the green hospitals, and all the initiatives, both on a domestic level and internationally. And will encourage, and this is very important, the collaborative efforts between countries, between the Middle East and the Western world, between developed and developing countries, and support from other nations and international organizations, of course, like the UN agencies.
Indeed. Sir, indeed, Egypt did hand over the presidency of the COP27 to the COP28 to the United Arab Emirates. How do you evaluate here the performance of Egypt during the past year for the COP27 before handing it over to the presidency of the COP28 to the United Arab Emirates?
So I believe the most important thing about COP is it's sustainable. You end up with a COP with action plan for the global initiatives, and then you continue and track and evaluate on the next one. In COP27, We generated a lot of reports and initiatives, like I was just saying, the National Food and Nutrition Strategies and the National Climate Strategy and the international collaborative alignment between countries to face the 1% decrease in the Earth temperature. And currently in COP28, we're seeing the initiatives are actually running and actually operating and in place in a lot of countries. We are seeing a lot of evaluation tools for the initiative that was launched last year. Egypt's presence is very important to track the national initiative that we actually launched last year, like the Green Hospitals I was just mentioning, and as well participating in the global partnerships and the global initiatives that was also launched. I believe if we continue putting enough and sustainable resources on the initiative, and that's what actually is very pivotal and very important, we will be able to achieve the climate change sustainability plan in 2030. Otherwise, we'll be facing another 1% increase in the Earth's temperature, and we are facing a lot of changes in terms of diseases, in terms of patterns, and in terms of agriculture as well.
Yes. As what we have seen throughout the past few days in the COP28 that kick-started on the 30th of November and will take place till the 12th of the current month of December, what's your expectation here from the COP28? What are the main challenges that we are expected to witness, that we would maybe overcome during the coming round of the COP?
So, as usual nowadays, the main challenge is financial sustainability of projects. And what we are aiming is to have enough funds, because not all nations are actually believing that climate change is strategic. Maybe there is a lot of plans, but on the ground, as I was just mentioning, we need more resources. We need more buy-in from governments. We need, for example, alignment on very simple and actions that actually can work on the ground for developing countries. We are talking especially in Africa, and we are talking as well on the industrial countries. And if we can see in history, the most developed countries are the countries with the highest carbon emission, and they do have poor carbon footprint. And the most actually damaged countries are the developing countries, where they are actually facing a lot of climate change, and they are not contributing to the carbon emission much as Europe and the US, for example. So we need to make sure that we do have alignment on the global initiatives and sustainability of the resources and the financial aid coming for this cause.
Indeed, sir. And back to the issue here of how to overcome malnutrition and the threat of the food shortages in the world. As the initiative ICAN was the first launched by Egypt during the COP27 activities, what are our expectations from the achievements that we want to reach from this initiative, and how we can overcome the challenge here of malnutrition and the lack of proper food production?
So if we are talking specifically about Egypt, the Initiative for Climate Action and Nutrition, ICAN, is focusing on the accelerating efforts between nutrition, transition to sustainable food systems, and the public health and education and water system. So we are talking about an integrative cycle between, as you mentioned, how can agriculture affect the malnutrition. We do have currently, alhamdulillah, a decreased incidence of malnutrition among school children. We launched the presidential initiative for school children nutrition 3 years ago, and we are actually currently having this year a decrease in the incidence of malnutrition, of stunting, which is short stature, and in anemia. However, we need to make sure that we are sustaining the food supply with good nutritional impact. We do have school meals that's actually sustainable. And if we are talking about agriculture, we need to make sure that we are using crops, which is, maybe it's okay to use genetic engineered crops, however, within the international permitted thresholds, and to be as organic as it should, to be able to provide the nutritious and food security for children and as well for adults in Egypt.
Yes. How can we link here the issue of trying to overcome the food problems and provide proper food and good nutrition in order to avoid facing the problems, the health, specifically problems of malnutrition, especially in many countries over in the African continent and all over the globe here.
Yes, if we're talking malnutrition, we're talking about impact on shortage, stunting. We're talking about anemia. We're talking as well as obesity, because most of people, they think that obese children, they don't have malnutrition. However, many of them, they suffer from anemia and malnutrition as well because of bad diets and bad food. And if we would like to tackle the malnutrition, we need to tackle it from the first 1,000 days, from pregnancy till 3 years from birth. These are actually the golden era, and hence it's called the golden 1,000 days, because in these 1,000 days, we are forming the future of the babies, the future of our children. It's very important that we do have fortified foods and increase the fortified food, whether we're talking about iodine or other nutrition that can actually fortify the food our children are taking. We need to make sure that we do have sustainable, good school meals at schools. We need to have good education for the mothers on how they actually feed their babies, how they maintain a healthy, good meal all over the day, and they provide enough nutritious to make sure that they are actually building their bodies and they are growing healthy, and not just feeding them a lot of sugars, a lot of fats, and just make them stay quiet in order to give them treats. So all of these malpractices we need to address in terms of education. And if we can talk here about Egypt specifically, Egypt launched 2 months ago a presidential initiative called the Golden 1,000 Days. It's tackling exactly the first 1,000 days we are talking about, on how to educate mothers, on how to track breastfeeding and encourage it, and how to make sure that we are avoiding C-section or cesarean delivery as much as possible.
Yes. Finally, Dr. Anan, as a professor of epidemiology and pharmacoeconomics, how do you expect to witness a change in the chain here of food supplies in order to try to overcome the problems of malnutrition and the food distribution in the world? And what's your expectation on the personal level from the COP28 this round by the presidency of the United Arab Emirates?
So if we're talking about sustainability of food supply, I can be a bit more optimistic than the previous years. However, it's still with caution. Still, there is disruption in the supply chain. Still, there is a lot of inequalities, and equity is not actually sustained across all nations on a global level. We are seeing a lot of countries lacking good supply in terms of food and nutrition, and we see a lot of countries having huge waste every year, and they are just actually throwing crops. So if we can just maintain a good supply chain, I believe it will be very easy to make sure that our earth are not currently suffering from hunger. We don't have no malnutrition. We don't have children who are actually dying because of hunger and because of malnutrition. I'm a bit optimistic more than the previous years. Last year I was more optimistic. This year I'm more optimistic. However, all the time I'm putting a lot of question marks, a lot of exclamation mark on the equity the world is actually providing to poor countries. However, I can see the alignments, what Egypt is doing in the Middle East, what United Arab Emirates are actually hosting this year. I can see a lot of positive commitments. I hope that these commitments will be transformed from the global and from the Western world into real operational commitment towards food supply chain, especially to the developing and the poor countries in Africa.
Indeed, Dr. Islam Anan, professor of